In 1849, the first female doctor in the United States. Her name was Elizabeth Blackwell. She went to Geneva College in New York, which is now the Hobart College, which she was the first female doctor in the United States. Hi Megan, I can see you're here. Welcome. Hope you're doing well and glad to see you here. I'm talking about a little history beforehand. Yes, it is a cold, rainy night, Megan. It is hailing up here. We've got a mixture, I don't know, up here in New York, we've got a mixture of freezing rain and water, and it's not very nice out there. I just drove home from my other job, and it is pretty cold out there. So anyway, in 1849, the first woman doctor, her name was Elizabeth Blackwell. She got the highest grades in her class. How empowering for women. In 1857, after several years in a private practice, with her sister Emily, who ended up being a doctor as well, they founded the Infirmary for Women and Children in New York to provide health care to women. And I love this history. You know, this is my passion. I love women's health. It's what I love and I have a passion for. To find this on History Today was really, really awesome. In 1868, she expanded to include a women's college within that organization to teach other women how to become doctors and nurses. And she ended up going, she was originally from England, and she did go back to England in 1857, and she became a professor in gynecology. I love it. So in gynecology, and she became a professor at the London School of Medicine for Women, and she actually helped create gynecology, which is amazing. And for me, it's my passion. So it was great to see that in today's history. So it's 8:02 already. I'm sorry, I got a little bit on a rant on that wonderful history. Welcome everybody. Lori from Women's Health on the Go. Tonight we're going to talk about a breast issue. We're going to talk about breast cysts in the breast, which someone had requested the information. So we're definitely going to get to that. But remember, number one, it is January. It's Cervical Cancer Awareness Month. If you have not gotten your pap smear recently, make sure that you go get it. Cervical cancer is very prevalent. It's still around 12,000 women a year get diagnosed. Help prevent that. It's easily prevented by making sure you go for your pap smears when you're supposed to. So make sure that you go out there. Make sure you go to your provider. Are you due? Find out what your protocols are and make sure that you definitely do that, okay? Hi, Debbie. How you doing? Great to see you as well. If you haven't signed up for my newsletter, make sure that you do. I just sent one out. I'm revamping everything as well. My website's going to get updated as well. I've got so many things going on right now, and I'm really, really excited. But if you haven't signed up for my newsletter, go over to womenshealthonthego.com and definitely subscribe to it, and I'll make sure that you get this month's newsletter. And also, you get a free pamphlet on how to take care of your hoo-ha. And make sure it's nice and healthy. So tonight, let's get into it. We're going to talk about breast cysts. And I thought that there's just so much to talk about when it comes to our girls. I call them the girls. They're very, very important. There's so many things that can happen with them. Breast cancer is it's so out there. There's so many people worldwide now. The last statistics that we have data for are 2012, which I know it's becoming a little bit old, but 1.7 million women in this world were diagnosed with breast cancer. In 2015, in the United States, 60,000 were diagnosed with what we call in situ, which is just within the ducts and within the glands. And then you have invasive, and invasive is when it starts going into other tissue areas. And 231,000 women were diagnosed with that just in 2015. And that caused around 40,000 deaths in women. And this is really important. What I'm talking about tonight is, well, it depends. There's different kinds of cysts that we can actually have. Typically some of them are very benign, but they can be malignant as well. And there are so many things that can happen with breasts. I'm only touching on one thing, so, and I'm sure I can make a show out of the screening guidelines, because they have changed so much over the years. You have different organizations that have different recommendations. I can make a show out of that just by itself. But tonight I had a request to talk about breast cysts, so we're going to talk about it. But what I want to start off with is, what are you going to do when you find a lump in your breast? And it's pretty simple. The first thing that we're going to do is, you got to look at where you are in your cycle, because we get mood swings before our periods. I say the girls get mood swings as well. And so sometimes we can get lumps in our breast before our period, and once the period has ended, they will go away. So typically when women find a lump in the breast, the first thing I do is, find out where they are in their cycle. And if you find a lump in your breast, find out where you are in your cycle. If it is right before your period, just don't panic just yet. Just wait until after your period, and then do another exam on yourself. If after you have done that exam on yourself and you still feel a lump, absolutely go to a provider and get an exam, and then get further testing. Most women who find lumps in their breast, they're going to be benign. The guidelines actually for women doing self-breast exams has kind of been changing as well, because a lot of times when we do find lumps in our breast, they're very benign. We end up doing testing, and there's the high anxiety of the testing, and then going just through exposing ourselves to stuff, and the majority of the time, they're nothing. But that doesn't mean that we don't have to get it checked out, because I think it's really, really important. So if you find a lump in your breast, which you're going to either find a lump in your breast. Sometimes people have breast pain. Sometimes also, when you do a self-breast exam on yourself, sometimes you'll find what you'll have is called dimpling of the tissue. And basically, I'm going to stand up a little bit. If you put your hands on your hips and you kind of contract all those, those chest muscle walls, if there is a lump along, like very close to the wall of your chest, and when you contract, it's actually going to pull in a little bit on the skin, and you're actually going to get a dimpling. So if you see that, or if all of a sudden one of your nipples just all of a sudden used to be popping out all the time and all of a sudden it goes in, that's another kind of symptom. Sometimes people will have heaviness. Sometimes one breast will get a lot bigger than the other. These are kind of symptoms that also, most of the time we feel a lump in our breast, but these are also other kind of symptoms that we can have. When you go to your healthcare provider, they'll do a breast exam on you. Typically, if you are under 30 years of age, because your breasts are what I call, and what everybody else calls, is very dense, I tend to do, when I'm talking to patients, a lot of times I talk about comparisons to things in life, and sometimes people laugh at me at what I kind of describe. But for women that are really young and under 30, and I talk about dense breasts as compared to other breasts, I say, just think of a forest in the summer. There's leaves on the trees, and you can't see anything through those trees. That's what dense breasts are. Other breasts, as we get older, is called the forest in the winter. The leaves are down, and I can see clearly through that forest. And that's the way I kind of describe dense breasts as compared to not dense breasts. And when you're under 30 years of age, your breasts are typically dense. So typically you're not going to have a mammogram, because a mammogram can't really look through the summer forest. It can only look through the winter forest. So typically an ultrasound is only done. Depending, once in a while they will request a mammogram, but typically it's just a breast ultrasound. And then if you're over 30 years of age, what will happen is that you'll get what's called a diagnostic mammogram, and then also a breast ultrasound. Now, what is the difference? Well, when you have a screening mammogram, first off, they're just doing a couple views and you're out the door. Where a diagnostic is actually looking at the area. When we do a prescription or referral for someone who has a breast lump, we are actually describing where the breast lump is, what size we think it is, and all this kind of stuff, so they can concentrate on that one area and they can figure out what is exactly going on. So the mammogram is going to kind of When we're talking about breast cysts, of course, right now we're talking about breast cysts. There's lots of other findings that we can have when we have a abnormal mammogram, but remember, tonight we're just focusing on breast cysts. So, welcome, Dave. I see you. Happy birthday. It is Dave, is my father. He's joined, and it's his birthday, so let's wish him a happy birthday. So, anyway, we're going to keep going on. So, when we talk about mammograms, and we're talking about breast cysts, remember, we're just talking about breast cysts. Mammograms are going to basically say if they see one cyst versus sometimes you may see a big cyst, but it's basically a cluster of a whole bunch of little cysts, okay? So that's what a mammogram is really going to do, to actually kind of focus on. Where an ultrasound is going to kind of be able to more look at, is it solid? Is it liquid? Not only is it solid, but does it have what we call septums of it, which are like walls that are going to separate. So there's different kind of, the ultrasound is really the key when we're talking about breast cysts, okay? So, and there's different kinds of cysts. You have 3 different kinds of breast cysts. You have simple ones, you have complicated ones, and then you have complex ones, all right? So let's go through that a little bit. When you have a simple cyst, now a simple cyst, if you have a simple cyst, there is no risk of it developing into cancer. It is cancer. It's just a fluid-filled cystic structure within the breast. The way you diagnose it is through an ultrasound. When you're doing an ultrasound, any kind of ultrasound, when a radiologist is looking at it, they're looking for certain characteristics that are within whatever it is that they're looking at. So a simple cyst is going to just be basically a sac with fluid in it. There's going to be no what we call echo, there's no going to be no debris, there's no going to be thickening of the walls, there's lots of things that they're going to be kind of looking at. And another way is if they see that simple cyst, usually they say, oh, it's a simple cyst, don't worry about it, but sometimes people will have what's called an FNA, which is a fine needle aspiration, which is basically just putting a needle within it and aspirating the liquid from it. Now, as long as that liquid comes out and there's no blood in it, and if there's no blood in it, and then it collapses, it's called a simple cyst, and we move on, there's no risk. Okay, it's history, okay? Where a complicated one is like almost like the next level step, okay? There's no what we call, there's no solid matter in it, there is no thick walls, I was talking about the septum area, but there's these echo kind of debris that's kind of in it, and they are less than 1% of those are going to end up being cancerous. So it's very, very rare that those things the complicated ones tend to be cancerous. When we go to complex ones, which are they're actually a lot more complicated. That's why they're called they're complex. The walls of the cyst are thicker. They have what we call a septa, which is basically, just think of a cyst, and there's just some kind of wall structure that's kind of separating it, okay? They have solid components to it, okay? Typically, when they find these kind of cysts on a ultrasound, there is a higher risk of it being breast cancerous. This statistic is a very weird statistic to me, but we'll go with it. They say it's less than 1 to 23%. So I don't know why they just say it's not 0 to 23%, but that's how they actually define it. And so those are a little bit more complex. They're a little bit more worrisome, and typically when they see that on a finding, they're going to suggest that you have a biopsy. Now, when they look at the different criteria, there's different components that make it a higher risk. If you had like one component of it, they may go, okay, it's suspicious. Do we biopsy it? Do we keep an eye on it? There's so many dynamics here. It's crazy. But I'm just trying to give you an overview of everything. Hi, Daniela. I see you just joined. Welcome. We're talking about breast cysts tonight. Hopefully you'll find this information helpful. We're just going over the different types of breast cysts. So again, if it's complex, they're going to actually recommend that you have a biopsy done. Now, there's different kinds of biopsies, and it all depends on what's going on. Now, if we're talking about breast cysts, we're not going to be having skin changes on the skin of our breasts. And one type of breast biopsy that is done is called a punch biopsy, and that's typically when there are changes on the skin of our breasts that we end up doing a little kind of just, it's a punch biopsy. Literally, there's like you just turn this, how do I say it? They basically cut around a section of your skin and they take that layer of skin off and take it to the laboratory because they want to see what's going on in that layer of skin. How about that? Hopefully that made a little bit of sense. Then we have fine needle aspiration cyst. And again, that's where they put the needle in the cyst and they aspirate what's going on inside. Depending, sometimes if the lump is right here and you can see it, you can just kind of put it in there and take it out. But if it's more deeper, they'll do what's called an ultrasound guided fine needle, an FNA, fine needle aspiration. And that'll be a little bit deeper. Then you have a core needle biopsy. A core needle biopsy is the needle, the hole of the needle is a lot bigger. Because basically, actually, I was yesterday watching a documentary about, in the Arctic, how the scientists, they go in and they kind of drill and they get like a sliver of all of the ice, and they're able to actually kind of see the years and years of what's been going on in ice. A core needle biopsy is a little bit kind of same way. So you can either have a core needle biopsy, if you can see it very easily, you can do it right away, like right from the skin. If it's a little bit deeper, they'll do it guided via an ultrasound, or what they call stereotactic, which is guided through a mammogram. And basically it's a thicker bored needle that goes in and kind of takes a biopsy through that. They get a little kind of more of a chunk of the tissue, as compared to when you do a fine needle aspiration, you're actually just taking liquid out. Emily, I see that you also have joined. Welcome. I hope all is well. Obviously, we're talking about breast cysts tonight. So, whenever they do a biopsy, typically they're going to put a clip in the placement area. That is for later on. They know exactly where they took the biopsy from. They know where the abnormality area is. So they'll put, like, it's a very tiny little clip, so that when you have a mammogram ever done, they can see the clip, they can see where it was, if there's any abnormalities or what's going on. If they need to monitor that area, they know exactly the area of where that was biopsied. So how are we going to take care of this? Now, again, remember, we're just talking about breast cysts. There are many different things that could be going on with the breast. You can, when we're having a lump in the breast, and we're trying to evaluate it, you can have what's called an abscess, which is more of an infection. Typically, you're not just going to go, oh, I got a lump in the breast. You're going to actually have tenderness, redness. It's going to feel warm. You may have a fever because you actually have an infection. You may have what we call a hematoma, which is basically a blood-filled sac, which typically happens from trauma. Or you can have fat necrosis, which is basically fat tissue that's kind of dying, and again, that's from trauma. You can have an oil cyst, which is basically a liquefied fat cyst in your breast. So when we're trying to, and again, there's also the chance of cancer. It's, depending on what kind of cyst you have, depending on level of risk that you may have of having cancer. So these are all the kind of things that we're kind of ruling out. There's also a lot of other things. I'm just talking about liquid-filled kind of cystic structures. But remember, tonight we're just kind of talking about breast cysts. So how are we going to manage these cysts? Well, a simple cyst, we're not really not going to do anything. A simple cyst is something that's not going to turn into cancer. There's no risk of it turning into cancer. And unless that cyst is bothering you, we're really not going to do much with it. Sometimes if a cyst is pretty big, it's causing pain, it's causing discomfort, Or sometimes if it's on the surface and it's actually making your boob either look bigger or distorted, then you're going to want something done with that. And typically that's just going to be getting aspirated. Does it come back? There's a possibility that it can. Sometimes you actually, when it comes to a cyst, when you do a fine needle aspiration and you're kind of collapsing that cyst, you're just taking the liquid out of it. But the core, meaning the balloon, okay, if you think about a cyst, a balloon with the water, looks like a water balloon, is filled. When you take out the water, you still have the balloon, right? So there is a risk of it kind of just developing all over again. And depending on if it keeps developing, then you really have to kind of look at what's going on. But typically a simple cyst, you just get rid of it and that's it. You're all done. Now, a complicated one, depending on, when they see a complicated cyst, there's kind of two ways that, now I know that I talked about biopsies and stuff, but if I get a mammogram report and I see that, it has characteristics and it says this is a complicated cyst, they're going to either suggest typically either having a biopsy done, or they may say, let's keep an eye on it to see exactly what's going on. Now, this is where it comes into compliance. Now, if I have a patient I know that is not going to be coming back, which does happen, then I'm going to tend to kind of push them more to go get a biopsy to see what's going on right now. But if someone I know is very on top of things and very kind of, we'll call organized, and they just really don't want to have a biopsy, they may want to try to do things naturally or try to get rid of it on their own, then every 6 months for at least the next 2 years, you're going to need ultrasounds, mammograms to follow up to kind of check on the stability to see what's going on with it. So that's typically, so you have those kind of two options when we're talking about complicated ones. Remember, simple cysts are very benign. Complicated, you have less than 1% chance that it's going to be cancerous. So because it's very rare that that ends up being cancerous, you have that option of, some people want to know right away, I want a biopsy and I want to know what's going on. And then there's other people that go, you know what? I don't want anything done. I want to keep an eye on it. I want to try to maybe even do something naturally to kind of get rid of it on its own, and let's do a follow-up. Hi, Phyllis. Welcome. I hope all is well with you. We're talking about breast cysts tonight, so hopefully, hopefully you enjoy the show. So I'm so happy to see you. I miss you, girl. Phyllis. Good, wonderful person. Love her. Okay, so then we're going to talk about complicated cysts of kind of management. Complex. We've gone from simple, complicated to complex. Complex, remember, the risk of cancer is, I'm just going to say from 0 to 23%, because they say it's less than 1 to 23%. I don't know, that's kind of cuckoo statistics to me, but these people are going to, I would highly, absolutely 100% recommend, you gotta go get a biopsy. We gotta know what's going on with that cyst, okay? So that's really, really important. So basically complex, we're gonna biopsy it. Whether we're gonna do an excisional, can't even say that word right now, excisional biopsy, really kind of depends on the whole. They do a biopsy depending on where it is. Sometimes they just do, like I said, the core needle biopsy. Sometimes they actually will end up taking the whole area out. Welcome, Linda. I see you as well. Welcome. Hope you're doing well tonight. We're talking about breast cysts tonight. But we're getting into the natural remedies of what we can do with breast cysts on our own to help them and hopefully prevent them from kind of happening. Now, I mentioned this thing last week I was talking last week about fibroids, and this week it's the same, one of the same things. Hi Donna, how are you? Welcome as well. We're talking about breast cysts, so hopefully this will be informative for you. Hot castor oil packs. For some reason that's a tongue twister for me, but there is no, when I like to look at natural remedies or even also Western medicine stuff, I love research. It's what I learned. I'm a women's health nurse practitioner. I learned how to do things based on research. And there is really no research about hot castor oil packs, but lots of people talking about it, and lots of people are saying the success that they've had with them. They use hot castor oil packs. I'm so proud that I'm saying that very good tonight, on uterine fibroids, ovarian cysts, and actually breast cysts as well. It's a little bit of a kind of system that you have to do. You have to get a towel, you have to get the castor oil, which is very sticky and very thick. You have to soak the washcloth. Then you have to have some kind of plastic, because basically what you're going to do is you're going to put that washcloth over your breast. You're going to then put some plastic over, because the castor oil is sticky and it is nasty. And then you're going to take some kind of heating implement. I like, people have those rice packs. They've got those pillows. They've got a little rice in them. They put them in the microwave or something. Those, and you put that over there. And there is a regime of how you do it. And basically the concept is the castor oil is going to draw out all the toxins and everything out, and it's going to resolve your cysts. People talk about it all the time. They apparently have success with it. Unfortunately, there is no research for me to tell you about it, but all I can do is tell you is that there's lots of people with lots of experiences with it, so I'm going to tell you about it. Avoiding caffeine. Caffeine is definitely one thing that can cause cystic structures in the breast. And when I'm saying avoiding caffeine, it's not just coffee, it's soda, it's tea. There's anything with caffeine in it. And there is kind of debate on whether, some people like to have decaffeinated stuff. There's sometimes, there's some research that people say even the non-caffeinated don't, the coffee and stuff, don't have that. So, that really stinks if you ask me. Anyway, wearing obviously a well-fitted bra, warm or cool compresses. I think that kind of depends on, a lot of times when people have cysts, they're actually going to have discomfort. What makes you feel better? Is it the warmth or the coolness? Kind of really depends on you. Let's say, diet. A lot of things in our lives actually are based on inflammation in our body. And inflammation is caused by, there's like a trickle kind of event. There's stress in our life, and when you look at the hormones in our lives, and there's a lot to do with cortisol, which is a stress hormone, and depending on if it's elevated or not, your body can only handle so much stress. And when your body has too much stress on it, your body actually goes, well, I can't handle the stress anymore, and then it ends up that because your body, those hormones and that regulatory system cannot handle that stress, then the body just starts breaking down however it is, whatever the medical condition. You can have breast cysts, you can have ovarian cysts, you can have diabetes, high blood pressure. There's this theory that basically stress and the cortisol level and the inflammation in our body causes a lot of what we call disease in our body. So we want to kind of just get rid of all that, which is hard in our society kind of to do, to eat right, to exercise and be stress-free. But that is a core of probably a lot of things that I'm going to talk about, a lot of things I'm always going to be saying to you. You got to get rid of the stress. You got to get rid of the inflammation in your body. And this is kind of the same thing. So one, your diet, following an anti-inflammatory diet, which I know that I have talked about in the past. There's hormones also in our meats and our dairy, so you want to avoid meat and dairy. You want to decrease your fat intake. Fat, so a lot of times things that go on in our breasts are hormone related. Fat is a great place for us to store estrogen, so you want to decrease that fat intake. You want to decrease the fat in our body because that's where there are extra stored toxins. So you want to get rid of that. You want to increase your vegetables and good healthy eating, which is the core to everything, to be honest with you. There's some research on flaxseed. There was research done in Canada with flaxseed and breast cancer. And they showed that women who actually ate flaxseed and had breast cancer actually decreased their breast cancer tumors. So It doesn't hurt to start adding flaxseed to our diet, you know, definitely to help prevent cancer, but also it's also anti-inflammatory. Evening primrose oil is actually another great oil, even if you massaged your breasts with it as well. A lot of people, you can take it orally, but that's very good for, can't think of the word, breast pain. Thank you. Another thing to do is, so we want to make sure that our breasts are able to release toxins in our body. And of course, the closest area to that is our underarm area. So you want to be careful with the deodorant you use, especially antiperspirants. When you use antiperspirants from the store, they have, let's not even talk about the toxins that are in there. I have a great video that I talk about how to make your own homemade deodorant. I'm going to have to put the link above. Definitely check it out. It's very easy, simple, 3 ingredients from your kitchen, and it doesn't have the chemicals and all the gooky, gross stuff that's going to actually cause us to have problems. But when you're talking about antiperspirants, they're trying to avoid you from sweating. You need to sweat. It's important that you sweat. That's how our body releases toxins. And if you're clogging that in there, then there's going to be no place for that to go. And your breasts are going to have nowhere to release those toxins and release the estrogen, the extra estrogen in our body. So make sure you watch what kind of deodorant you use, okay? Hopefully that all makes sense. Decrease your salt intake. Salt retains fluid, so decrease your salt intake. Put fiber in your diet because you want to make sure that you're having a number 2 every day, because that's also it's a way that we're releasing toxins through our body. And when we talk about herbs, and as I always say with everything, this is educational, you have to honor herbs like you do pharmaceutical drugs. They have interactions. They may be contraindicated with medication you're taking or with a medical condition. So make sure that you talk to somebody that is knowledgeable in herbal medicine if you're going to start these things on your own. But one of the things when we're talking about herbs is always, when we're talking about women's health things, one of the things is we want liver cleansers, because we want to make sure that our body is releasing not only toxins, but the extra floating estrogen in our body out, so that we don't have these girly issues. So liver detoxers such as dandelion, milk thistle, also about hormone regulations. You know, do we have too much estrogen? Not enough with what's going on with our hormone levels. And one of a great thing is Vitex or / chasteberry, which is a great hormone regulator. And then there's some, I'm going overtime here, but that's okay. But there are also some massages, like a lot of people also talk about if you have breast cysts, you want to massage your breasts, and you want to, because if you massage your breasts, that's going to make sure that they're having a good flow to release the toxins in our bodies. There's lots of ways to make sure that you massage your breasts appropriately, and you want to just always make sure that when you do it, that you're pushing towards this underarm area, because that's where you want the toxins to be released from, okay? So there is information about poke root massage oil. There's red clover massage oil. These are all things that help with breast cysts. Turmeric, which is a great spice, it's anti-inflammatory. They're actually seeing that turmeric may be what we call, I just found out recently that it may be what we call an adaptogen. Adaptogen herbs are herbs that work on the body just all general. They don't necessarily help with one thing, but they just overall help the body with stress and function correctly. And there is some, apparently some research that's coming out that turmeric may be one of those things. And so turmeric is another thing because it's anti-inflammatory as well. And then there's the good old fashioned cabbage leaves. Now, when women are breastfeeding, and if they get engorged, which is basically they just get really full of milk and it gets very tight and very tender. And if you put cabbage leaves on them, that actually helps release all of that swelling. So there are some people who actually use cabbage leaves on their breasts when they have breast cysts to help decrease the swelling in the breasts. So that is kind of breast cysts in about a half hour. There's probably so much more that I can say, but we're running out of time. We ran out of kind of time, and I'm always hoping that these, my live feeds can give you some just basic information about things that we as women go through, and help you give a little bit of a knowledge so that you're a little bit more informed and that you're able to kind of help yourselves a little bit. Of course, always, if you have a breast lump, make sure that you go to a provider and get that evaluated, because there are risks of breast cancer. So you definitely want to make sure that you go get that evaluated. If you have any further questions about breast cysts, I'm sure that I will have more topics about other breast conditions, because there's so many things that can go on in breasts in the future, but please do not hesitate to reach out, or of course you can always make an appointment with me, womenshealthonthego.com. I have different kind of scheduled times. If you think you need 15 minutes, 30 minutes, or an hour to talk to me, I have all of those appointments, so that we can sit down and we can have a video chat and we can really get down and really talk about what's going on with you. So don't hesitate to do that. I am very, very, very excited. Next week, I'm actually going to have a guest on my show. So I'm very, very excited. So we're not going to be here. We're actually going to be in a different spot, because I'm going to have a guest next to me. I am having Leah Quinn, who owns Heart and Soul Aromatherapy Apothecary in Beacon, New York, because I want to add natural kind of therapies as well, and start talking about these with people so that you are informed and you know the different things that we can do. And we're going to talk about aromatherapy and essential oils just to start to get the conversation going. And me and Leah have sat down. We're going to talk about other things that we can actually talk about down the road, and I've got other guests kind of lined up as well. So I'm really, really excited about that. So make sure that you tune in next week at 8 p.m. And I'm going to have a guest. I'm so excited. And that's about it for tonight, everybody. I hope that you found this information informative. Again, if you haven't signed up for my newsletter, make sure you go over to womenshealthonthego.com, subscribe to my newsletter. You'll get a free pamphlet on lots of great healthy things to take care of your hoo-ha down there. And you'll get, right now I have a monthly newsletter, but I'm kind of changing everything. We're going to be constantly giving you lots of great health information, and I'm very excited about that. I will see you next week. Take care, and remember, women's health matters. Our bodies matter. Let's make sure we take care of ourselves. And I will see you next week. Take care, everybody. Bye-bye.